Welcome to the latest in my Echo Education series. Today, just looking at left atrial appendage occluder device for the Amplatzer amulet type, where it had a relative mass-like appearance in the left atrium. From this picture just on the right here, we can see the fact that we have this appearance of this structure here. Left atrial appendage, of course, goes up there. In terms of the LAAO devices, there are various different types, of which there are numerous ones. The procedure has a pretty high success rate. Of course, there are various procedural complications and also some longer term ones, such as the device-related thrombus or residual around device, which they consider more than about 5 millimeters to be a significant size. There can be embolization of the devices, device migration, erosion, and also device puckling is a term that also has been discussed in the literature. There's a particular type of artifact just associated with the Amplatzer device, which they call a figure of 8 artifact, which has been described as well, where two circles appear on top of each other. In this case, it's not what I'm seeing, but it can be something that can be seen associated with the devices. In terms of the current case, a 80-year-old woman, and initially I saw her in about 2014, when she's found to have severe mitral regurgitation, and then she had a mitral valve bioprosthesis inserted after that. In 2020, she then had a left atrial appendage occlusion done with a 28mm device. I saw her more recently in casing for an echo to assess query CCF. There was some LV dysfunction. The mitral valve actually looks surprisingly good given its age, and also the left atrial appendage device appeared quite prominent echogenic, but there was no definite thrombus to be seen, but I think in reality we'd have to compare it to the previous images to make sure there had been no movement of the actual device. In the parasternal long axis view, we can see a number of things. Initially, we look in that left ventricle, just looks a little bit down in its function. There is a prominent looking proximal septal bulge there. We can see the struts of the bioprosthetic valve, as well as some calcification of the chordae there. Have quite a large left atrium, and there does appear to be some artifact when we're looking at the upper portion of the left atrium in this view. Looking at the mitral valve here with the colour flow, the forward velocities don't seem excessively increased, and similarly there's no mitral regurgitation too. When tilting over in this view, we can now see this more prominent looking structure in the left atrium. And when similarly zoom up upon it, and now it seems to be quite delineated in terms of this relative structure that can be seen. In the parasternal short axis view at the aortic valve level, we do see again this apparent structure just here. The left orifice of the left atrial appendage would be around this level as well, though, and the left atrial appendage would be extending up in this view. And when we zoom upon it, we can actually see that same structure there. And a little bit more clearly from this view. And looking quite broad and quite long in this view. In the four-chamber view, the structure isn't initially apparent, but there is a structure that comes into view through the respiratory cycle to be seen there. And similarly as well, just this small central structure appears on closer inspection. The actual valve appears to be fine, possibly a bit of thickening around the bases, but apparent good motion, not excessively thickened around the leaflet tips, and adequate mobility. When tilting a little bit anteriorly, we now then start bringing this apparent mass into far more view in comparison. And zooming on it, we can see quite a dense looking structure. No definite active free edge involved, even though there's apparently a little bit of movement there that just may be an artifact from the movement itself of the picture. As I was saying before, just very mildly reduced left ventricular function, and over where we do have that caudal and papillary muscle calcification, it does appear to be less movement as well. When we look in the two-chamber view, we again start to see this relative structure appear over here, where we would expect to see the left atrial appendage. And zooming upon it, we see Just in this state, the image doesn't appear to be too thickened. In the apical long axis view, in the initial view, there's no visualization of that mass until we actually tilt over and bring it more into a better perspective. So as we tilt over, we now have this structure here that does appear, and even more prominently in this view. And zooming upon it, looks quite dense when there's no apparent figure of 8 artifact really associated with this one. And in keeping with the other images, just down a little bit with that function. In the subcostal four-chamber view, we similarly as well do see this mass in the middle of the left atrium there. And given the fact that we can see it from all these different imaging planes, it takes it away from being purely a mitral valve artifact. Here's just looking at the left anterior lung. You can see a couple of B lines. We're just looking over on the right side. There's a few more ultrasound B lines consistent with this extravascular water. We can also see some impairment of ventricular strain, the global longitudinal strain around negative 12%. And so looking at the relative size of the structure in different views, we appear to be about 4.4 by 1.8 centimeters. And this second view, it's about 3.9 by about 3 centimeters. And given it's a 32 millimeter device, that's probably relatively consistent with what you'd actually expect. And then the last view there is about 2.7 by 2 centimeters. Thank you for watching the latest in my Echo Education series.